Okay, good morning, everyone. Welcome to our MOTS EDI webinar. It looks like all my coworkers are here. I haven't heard anyone, but just a quick check to make sure that everybody can see my screen and I can be heard and seen and everything. So if I can have somebody confirm that, then I think we can get going.
Hey, Pete. Hey, Pete. This is Jody.
Thank you.
I can see it nice and clear, and I can hear you. So I think we're good.
Excellent, because I was having some messages saying that there might be some network slowdowns here and there, and my earlier start this morning, I had some issues getting going, but it's hopefully it's working fine. So okay, welcome everyone. Welcome to our EDI webinar, September 2nd, 2020 already. It's almost the end of summer, but weather-wise, I think we're going to have a great one for the next week or two. So that'll be great. Welcome, and for those of you who are not aware, the webinar will be recorded and placed on our website. So if you can't watch the whole thing because you have another meeting coming up in a little bit or some emergency call that you are pulled away and you would like to watch the rest of it later, we do record it and we place it on our website, and it usually takes a day or 2, 3 before we have it out there. So it takes some paperwork, but we get it out there. So you all have received a little pop-up menu when you joined, and in that menu there is a box where you can type in some questions, some chat box and a question box. So if you have any issues or something's not clear, or you want us to explain a little more or clarify something, then you can just type it in there, and we, or whoever is not talking at the time, is usually watching those question and chat box, and hopefully we can answer those questions. So, because that's one of the purposes of today's webinar and all of our webinars, to give you information and answer your questions, get feedback, and maybe ideas for future webinar topics. Maybe there's something within your organization that you've all noticed and you kind of said, hey, yeah, maybe that should be good to talk about. Maybe we can make this easier or improve that or make it. So and when there's data issues, we are always happy to discuss those. Or if we find out there are some data issues, there's something not really in sync somewhere in some of the systems and some of the procedures, then we like to use these. So, okay, let's get going. And why don't we them? Lyle, Jody, Mary, and Justin are all here, I've noticed. So the next item on the agenda, and we have a nice and full agenda, is going to be Lyle, and he's going to be talking about the state of affairs.
Good morning, everyone. Currently, the MOTS team is, we're all working from home. Email MOTS support with any current issues. We have all received state cell phones and will reach out by phone when necessary, but our goal is currently not to approach providers with any current data issues. So if you have any issues, feel free to come to us. We have canceled all in-person trainings. And if you need a training, just email MOTS support and we'll set up a one-on-one with you. So just be a little patient with us while we work right now.
Excellent. Thanks, Lyle. Yeah, and when you receive an email from somebody, the phone number in there is the state-issued cell phone. So if you need to talk to somebody right away, you can pick up that number and use that for whoever sent you that email. So thank you. Okay, there we go. Looks like we're getting going. Spoofed email for people. Something longer, but my email was hijacked or spoofed, as they call it. So, and what happens then is that some providers get an email message and they ask for payment, or there's an invoice attached, or and when you just on the surface you look at that email, it appears to be coming from me, from pete.j.vermeer@dhsoha.state.or.us. But if you mouse over that email in your inbox, you'll see that it's not me. And when you note, and especially if it talks about a payment or we need money or something like that, that's very suspicious, because we're never going to do that. So it's not as a what I remember last time when it happened, there were a whole bunch of emails going out and somebody really tried very hard. So this was just a few that I've heard of, but maybe everybody recognized it pretty quickly and they said, okay, we can throw it into their junk mail or report it to whatever procedure you have within your organization. So, but yeah, the way it's done, it's that it looks like the regular email, but behind it, there's another one. So, and it's, and try to trick you into clicking. Yes, that's one of the way they do it. You open the email and it says an attachment, and when you do that, it'll download some virus software or some other stuff that can disrupt your system, or it can hijack your system, and then what they can do is they take over your machine, put another password on it, and you can only get it back if you pay them money. So do not open any of those attachments. They might contain all kinds of viruses. So working on verify that the email from OHA is authentic, that it's really coming from us. And the one thing that I mentioned is check the display name in your email box. Just mouse over it, because you can't really see it on the surface. But if you mouse over it, then you'll see what the real email is, and it's usually some gunky, funky, nothing common like not gmail.com or something. It's very strange usually. Another word of warning is the MOTS team and the Health Services Division will never request a payment for invoices or send any invoices directly to providers. That's always done by different departments. So we'll never have to, never expect any of this. So one of the other things that you can use to spot those emails is check for obvious grammar mistakes and misspellings. They're pretty obvious sometimes on the more low key. The better spamming and phishing emails are getting better because they have spell check as the same as we have, of course. So you have to be a little careful. But if there's one or two obvious mistakes, then you can definitely see that. So. And an actual name instead of a generic reading, if it's actually for you, or if it's dear sir, or dear email user, or dear something like that. So just a couple of tips, and I'm pretty sure that if you want a lot more detail, and if you have something like that, it's probably a good idea to check with the organization and see what phishing or spam or junk mail, what procedure is used if you place it somewhere, if you report it somewhere, check that, and then you'll be able to deal with this. So I'm sorry that it happens once in a while, and I hope it didn't catch you this time. So, but it's also good to keep it in mind for future reference. There we go. And then I'm going to give the microphone to Jody, and she's going to talk about. There we go. Go ahead, Jody.
Okay, I'm just waiting for it to pop up here on my end. But yeah, thank you, Pete, for that. So this morning we kind of wanted to just kind of hopefully bring some clarity to a few concerns that we have received into MOTS support, as well as to myself. We've been receiving inquiries and questions as to whether or not reporting in MOTS is still required, or is there a new system? MOTS reporting is not going away and will continue to be required of all agencies providing behavioral health and substance use disorder services. We put until further notice, but it's pretty much submit data, keep doing what you're doing. What is happening is that there's within our organization, our executive management, and we have a team that is looking for more of a possible MOTS replacement, but it's also more of an enterprise-wide type of reporting that we're hoping to gather. And the reasons that we're looking at this is we're trying to find ways to streamline the data that you send to us and to lower the administrative burden. We're still going to continue to collect the similar and the same data as MOTS. It's just going to add some more flexibility to be able to send additional data, such as items that you may be sending on spreadsheets or other templates or other types of reporting to program staff or to different areas within OHA. Again, this is going to be an enterprise-wide effort, so it may include other systems. I know some of you may be doing some gambling reporting, which is outside of MOTS at the moment, and they are working on replacement. But as we move forward with these systems, we're looking to align data fields and to make things more streamlined so you're not having to enter these in multiple places. It's going to give us a better 360-degree view of the clients, the services, and the outcomes that they receive. We have had some questions from EHRs directly that have gotten questions from the providers or their customers or partners, however you're identified within that EHR company. And we have let them know that as we move forward, we are going to be collecting the similar data that is in MOTS.
You are breaking up a little
Pete
bit.
mentioned.
Sorry about that.
Oh, am I? Oh,
Yeah,
okay.
Maybe it's just me, Ben. Just repeat your last couple sentences roughly. Sorry.
Okay, so basically I just wanted to let you know that the EHR companies have reached out to us, and we have confirmed with them that, the fields we'll be collecting are going to be similar. Most of those, as Pete mentioned, are required fields for federal reporting and different purposes within the organization. So a lot of those, the majority, will not be going away. They may just be collected differently. We are going to, time-wise, this isn't happening this year or most likely next. We're in the early stages. We will continue to get provider and EHR system inputs. Implementation-wise, when the time comes, there will be many communications. There's going to be a lot of pre-planning. There'll be requirement specification, document distribution. We will have training. We'll have testing, all of those tasks that it takes well in advance. And for those of you that may have been around when MOTS came up in the beginning, very similar. It'll be a very thorough, holistic process that you will get well information on ahead of time. We've also incorporated the replies to our surveys on timeframes for system changes and implementation that were provided by many of you. So these have been factored into any new system rollout plans. And we would really like to say thank you for those that have reached out, for those that have filled out surveys, for those EHR companies that have taken calls from Pete and I to get technical information. And we welcome any suggestions or input. So we just are hoping this provides some clarity out there as to what is going on with MOTS and with our reporting. And as always, please reach out to myself or MOTS support, and we will make sure to try and get your questions answered or directed to the appropriate parties. And just know that you are part of the bigger solution of Oregon collecting its data. So our goal is to work collaboratively together to accomplish this goal. Thanks, Pete. I think that's it.
Excellent. Thank you
for this subject.
It's a good one. Yes, definitely. Okay, so I'm going back to the Mark. Where is my mouse? Oh, don't see that. Apologize. It's a bit of a lag. I was going to check the panel and see what questions there are. If there are any questions or any chats. That's always one thing, and I forgot to mention that to do is to see if there's any. I also cutting out badly, I heard. I apologize for that. There's nothing really we can do about it. I'll try to slow it down a little bit, but my connection is slow. So I'll quickly pass on the microphone to Mary. Hopefully her connection is better and she will be talking about recidivism.
Oh,
It's slow. Sorry.
yes, it's slow.
I did click on it, so but I'm afraid to click on it again. But I can.
Yeah, that's
there we
what
go.
happens with me.
Mm-hmm.
There we go.
Okay.
Go ahead, Mary.
Thank you, Pete. Good morning, everybody. And I'm going to talk about a little about recidivism. It's a fancy word for returning clients. What do you do when clients start a new treatment episode? So, and one of the common requests received for corrections is to change the emit date on an episode. Suppose you had submitted on August 2nd, 2020, a behavioral health treatment episode for client Jean Jones, and the admission date used was August 2nd, 2020. But Jean came in on July 28th. So she started treatment on July 28th, but her admit date August 2nd. So you would submit a correction to MOTS support to change her admit date from August 2nd to July 28, 2020. But if you have a returning client, changing the admit date for a previous episode is not going to solve the problem. It will only create new problems. Let's say that John Smith was a client in 2018. His admit date is June 27th, 2018. He finished treatment on September 15, 2018, but for some reason the episode was not closed in MOTS. Now, John has returned in 2020 for further treatment. You submit a new episode of August 1st, 2020, but you receive an error message that he already has an episode of June 27, 2018. So you submit a correction to change June 27, 2018 to August 1st, 2020. But this would not be correct. His record should reflect two different behavioral health treatment episodes. So the June 27, 2018 episode must be closed, and then you would submit a new episode with the August 1st, 2020 admission date. And then that would show that John has two separate episodes in the MOTS facility. So I hope that's helpful. And I'll pass it back to you, Pete.
Thank you, Mary. Yeah, we several times, so we thought we'd make that clear that the difference between multiple episodes or when you send in the request for a change of an admission date, it's only if it's a week or two off or something, but not years, because then it's pretty sure it's multiple episodes. So. Okay, EDI error messages. Jody.
All right, thanks, Pete. I'll see when my
There we go.
screen comes up
There
here.
you go.
Right. So we've had some inquiries from individuals. You know, there's a lot of you that are changing systems. There's some of you that have maybe been doing this for a long time. There may be new people. Got a lot of folks that are submitting data through EDI. And when you do so, you get error messages, whether they're in your results files that you get or whether it's something that your EHR system brings in and makes available to you. So we just want to remind everybody this document's pretty old, but it has stayed the same for quite a while because we haven't changed a lot with our specifications and the certification requirements. So EDI error messages are out there and available in the Appendix A of our document that is entitled File Transfer Specifications and Certifications Requirement. The most recent one is dated August 10th, 2015. That is going to be the correct one. This section of the document has the bulk of the error messages that you will come across. So, of course, as you can see on the screen, there's going to be, the current error message, and then alongside of it to the right, you're going to see an explanation. So just want to remind everybody that that document is out there. Pete is going to, on our next topic, going to be showing you kind of where that's at, where you can retrieve it from. If you have troubles retrieving it from the website, you can always reach out to me and I can get one to you. There are some error messages that may be a little bit ambiguous or hard to understand, a little more generic in nature, that may not have the explanation that is making it clear for you in this section. And when that happens, reach out to me or to MOTS support or both, and we will work to get you an answer, whether that's looking at your file to really determine what it was. So there's many ways for us to help you, but just want to remind everybody this document's out there. And it's really helpful, especially for maybe new people taking over some duties with MOTS, if you're moving to EDI and you've been doing client entry before. So this was just kind of a friendly reminder, and I will turn it back to Pete, and he's going to show you a little bit of our website and where this is at.
Thank you, Jody. To the agenda, hopefully. There we go. Okay. Yes, the MOTS website. For a while now, and we have changed some, but there's a lot of stuff out there. There's a lot of stuff about frequently asked questions, resource. Oh, I'm sorry. There's not that much I can do. Maybe if I talk a bit slower, that sometimes.
Well, actually, you started coming in clear
Sorry?
after I said that, so I apologize. I'll be quiet now.
Okay, thank you. And sometimes it is switching of pages that kind of takes over the connection, especially when it's slow. That's when I noticed that it cuts out as well. So as I was saying, a lot of resources, frequently asked question documents. We have several pages that we do about training, data requesting corrections, as Mary mentions, a lot of communications and newsletters, and all kinds of links to other departments and home pages. So I'll click to the link and it pops and it might be breaking. There you go. As you can see, the measures and outcomes tracking system, MOTS. It has a nice header with a COVID link, of course, but this is our main page. And as you can see on the left, there are all the different subjects, and it's about the OWITS that is still around a little bit, not that much, but the resource question training, online training, data request, communication, newsletters. You can see in the resources, when I click, it takes me to an overview of all the different documentations that we have. As you can see, how to delete a client, the batch file specifications and certification. This was the document that Jody was showing you, where it has those that you might be looking for. The MOTS reference manual is also one of the very popular ones. The user guide, system administrator guide, if there's anything that you're not really sure, or you're taking over responsibility from an individual that used to have that role, but they are going to do something else, get different responsibility, or maybe found a different job somewhere and it lands on your desk, then these are very good guides and very good manuals that give all the information that we could think of. And if, as we all mentioned before, if you're not really sure, always could send an email to mots.support. The training been expanding, and unfortunately doesn't show as much, but here are the places for the previous client entry webinar recording and the EDI from July 1st. And also we have dates, but unfortunately the dates will be canceled because I think it's been till the end of October, beginning of November. There's still not going to be any in-person training, but there's definitely the links to the webinars that you can sign up, and there's other information about any of the training. The nice thing is one of the things that Justin created is a video of bits and pieces of training that we have, and then also this is an overview, and this is a training of the CPD, the client profile data, a piece for the behavior health data. It talks about, and he does a very good job, slowly showing all the fields, talking about the fields, giving little information, bits and pieces, the addiction part, the non-Medicaid services, and it's all about the tool. But if you're not 100% sure about what your system, your EHR does, and how it links and how it processes some information, or if you have some questions about some information, maybe you could take a look at this video. It takes 5-10 minutes sometimes, not all of them that long, but just watch through it and you'll see all the different data fields that you should have in your EHR that should match up with the client entry tool. So they're all very helpful and very handy. The thing that Mary talked about, the request, where you can have a document, a spreadsheet, and this is if you are looking for reports, and if you have a correction, then you can see here the corrections we do. Most of the corrections you can do yourself if a client is active in your system. But there's 4 fields that you cannot touch because they're key identifiers within our database. So the last name at birth, the date of birth, the admission date, and the client ID that you gave to the client. So those 4 fields lock in the client and the treatment episode that we have. So if you have any of those fields that were entered incorrectly, or the individual in treatment came up and said, oh, sorry, I saw that you wrote my name incorrectly, or there was a spelling or a typo, or they transponded the date of birth or something like that. So you can always send, here's a document, another link to an Excel spreadsheet, and then you just complete the spreadsheet and send it to MOTS support. All these things are here. So some communication, some newsletters. We have Messenger that comes out once a month, and we try to keep up for just in case you missed it, or it goes to a different individual in your organization, or we have it set to go for a particular person and the person no longer works for you. So then you might miss it, and then you can look it up here and then request that in the future we'll send it to you. But that has to do with the agency or facility profile. Who's the system administrator in there? How is that set up? So but we can help you sort that. So also, the AMH homepage, the Health System Division homepage, and the Oregon Health Authority homepage. We have links to all these sites on our system here on our MOTS website. So lots of information, very helpful, and lots of things that you can look up if you want to. There we go. Back on the PowerPoint, and then I'll go back to agenda. And it is coming through, and then we go to our one. Has there been any questions from anybody that anybody thinks we should discuss on for everybody? Because I haven't had a chance to take a look at the questions. Or no. Okay, so then I'm going to tapping on. He has some great tips and advice for you.
Okay, I can see it here. So thanks. All right, thanks, Pete. And for a lot of you, this is probably, you've heard it before, so we're going to say it again, just in case you have things going on at your organization. Are you thinking of changing systems? Are you going to maybe get a new system for a pocket of your organization that needs to report? Let us know. That is probably the most important thing, even if it is 6 months to a year or further out. It helps us to prepare and make sure we have resources available for you. The second thing, with the health record system that you're looking at, or your EHR, EMR, really during your, the time that you're looking and getting presentations from vendors and whatnot, it's really important. We feel, we've gotten feedback from others, that having a MOTS functionality demonstration from them while you're looking is super helpful. This actually helps you to understand what the business process is going to be for this function within your new system. How is it going to work from the time the client comes in to the actual submission to MOTS? And, what if you get an error? What do you need to do to fix it and resend it? How much staff time is going to be required, and who will do which steps? There's no one way that is better than another. There are just differences in workflows, design, and development. And with today's flexibility, those are really good things. But as you move forward and you're looking for a system, it's good that you understand that I think there's a little bit of a myth out there that when you go to EDI versus maybe say entering through the web portal, that it's just like you won't need any staff time. It's just going to happen magically. Maybe not magically, but it's just going to happen. It's just going to be so much easier and quicker, and it will. It definitely helps to keep data cleaner from system to system. You don't have the human error as much when you're having to put it in manually, but there still is staff time, and it's good for you to know what that is so that you can make sure you have the proper people assigned. Moving beyond number 1 and 2, which I think are some of the most important ones, we've got project timing. We want to make sure we have resources available to you to do what needs to happen for your organization during this time. Process for switching the data submission method. If you're client entering through the web portal, we will actually talk about steps that we do to make sure that you can continue to report in one method until you're ready to go to EDI. If you're going from system to system, we'll also talk about how that's going to work and how you're going to set that up so you can continue to report from one to the other. Your secure file transfer protocol, for those of you who are new to EDI, that's really just a server here at the state where your files that come into MOTS get dropped off, processed, and a return file, results file, gets sent to you, that you pick it up. We set up the security rights, your login, your password, all that good stuff. It's pretty much like a mailbox where you send and receive mail. Client ID considerations, if you're going from one system to another or from the portal to EDI, are we going to keep those? Same client IDs that you've been using? If not, do we need to change them? And that's a process we can do here for you. Then, of course, testing of files through EDI. This is important. Some of you, when you're looking at different systems, they may say, well, we're MOTS compliant, or we have partners already submitting to MOTS, and that's good, so that you know that, okay, they're submitting. But we're going to test your files individually, because with all of the different designs and flexibility to really customize and make sure that your forms and your setup is working for you, we want to make sure that that data is coming through the files as expected. So we're going to test at your level, the provider level. You're going to go live, because we're going to get through testing, and then we're going to do some follow-up once you have gone live with sending data to MOTS. Whether you're new at EDI or you are moving from one system to another, the follow-up can be as short or as long as necessary. Usually they're a weekly call. Sometimes it could be more frequent or less, but it just helps you and your staff and our people here to make sure that everything's going as you expect, and that if there is anything that does come up or needs to be addressed, that we can make sure to have the resources to do that for you. So that is pretty much it. Standard stuff here on switching systems, but we do know that even with COVID and the new kind of working environments that are out there now for all of us, that these system changes are still happening. So we felt it was still relevant to go over this for those that needed it. So thank you for sticking with us and listening, and I'll turn it back to you, Pete.
Thank you, Jody. Yes, it is. It can be a stressful time to switch EDIs, because we know that Some of the sales departments of the particular EHRs do an excellent job on selling the new system to upper management, and then they come to you and say, okay, we have this new system and it's going to do everything for you. And then you have the difficult task of confronting management like, well, but this is not doing that and we're doing this differently. And so thinking of changing, let us know. Jody has a lot more detail about a lot of systems. She has a wealth of knowledge about all that information. So, and hopefully that can help.
Yeah, and I think again the biggest takeaway that we've learned is there's no one way that's better than another. It's just important that you and your teams understand how it's going to work so that you can make sure you have the resources and you get everything working as expected, and everybody's happy, right? At the end of the day, which that's the goal.
Yes, definitely. Okay, that brings us to the final point of the agenda already. And I still have not heard any questions or seen any questions from anybody pop up. So if you have any questions.
We do have one.
Go ahead.
We have a question from, I think this is Celine, wants to know if anyone has been using MOTS on Excel 2019. That's not something I'm familiar with.
It does not ring any bells for me either.
Yeah,
totally
you know, we.
Go ahead.
And I was going to say, so if this is in regards to importing the results files into your Excel, because that's usually if you, let me back up, if your organization picks up your results files from our FTP server and you then bring them into Excel so they're easier to sort and manage. I have received information from a provider that said they were having some issues getting it to work with 2019. For whoever this is that asked the question, I'm not sure if it's the same organization that contacted me, but if you would please contact me, you can go through MOTS support as well. What I'd like to do is set up a time to do a go-to meeting so that we could do a little screen sharing. Anybody who's using 2019, if you are successfully doing this, if you would reach out to me as well. But I'd like to kind of go back and forth. There's some uniquenesses with the results files and the importation. If you bring them in as a straight Excel, sometimes, or not Excel, but as an XML format, sometimes you don't get all the information. So whoever is on here that's using 2019, the one who had the question, please reach out. I'd like to set up a time so where we can walk through this together and see if we can find a resolve. If anybody already has a resolve, please reach out to me. Greatly appreciated. And we can do the same thing so you can let us know how that works. We, unfortunately, are not using Excel 2019. We are on the Office 365. And so we do not have that. I did check with our OIS teams and the support folks that we have, and nobody is using that. So I'm reaching out to the group here. Please connect with me so that we can try and find an answer to how this needs to work.
And she said she has a meeting next week, so looks like that part's already taken care of. We also have a question from Tom Bowers. Has RealD been considered for updating MOTS demographic data?
What I would say, unless Peterson wants to take this over, what I do know is that at the moment, we are not doing changes to MOTS to collect additional fields or information. With the effort to find a more enterprise-wide, streamlined reporting that will include that 360-degree view of the client, RealD has been brought into that project. We do have a business analyst who is working with our RealD person here on our teams at OHA. And so that will become a part of the new reporting system that will be in place. But at the moment, there is no intention to change the current MOTS setup or extract.
Excellent, Jody. Yes, that's exactly the way I've heard it. So no changes to MOTS. new system. It's in part of the discussion on how to set up and build the new enterprise-wide system. So yes, thank you. Any other questions? Okay. Well, thank you all very much. If anything pops up, you can always send an email to mots.support@dhsoha.state.or.us. As I mentioned at the beginning, we recorded this webinar and it will be posted on our website. On the website, it says the next one is focusing more on CE, but as you all know by now that both webinar, CE webinar and EDI webinar change focus a little bit, but if there's big changes or anything important, it wouldn't hurt to join us because we discuss all kinds of bits and pieces that are part of the MOTS world. So the next one will be Wednesday, first Wednesday of every month from 9 to 10, and the next Wednesday of October is going to be on October 7th. So hopefully see you there. Thank you all for joining us. Underneath we have all our emails and our link to our main website. So thank you all very much and have a wonderful rest of your day.